briefly introduce myself a little bit and why I'm here. I graduated from Shanghai University of Traditional Chinese Medicine in 1976. After that, I was sitting there also and taught and the traditional Chinese medicine there 10 years. Came to the United States, start over. I went to nursing school, learn English. So, at the graduate from nursing school, I was the neurosurgical nurse at the University of Pittsburgh Medical Center for 2 years. Then, and moved to Seattle, and I was the organ transplant nurse at the University of Washington Medical Center for 6 years. So, when I moved to Seattle, then I found the Bastyr. Also, that time also have Northwest Acupuncture and Fertility medicine. So, I said, I did this for a long time. I should go back to my, profession. So, and I started teaching at the Bastyr University in 1996. The reason I'm here is because, and I have been the teaching gynecology and since 1996. So lots of female patients, which is big group of patients in infertility. That's why I'm here. Okay, so infertility is let's say that's the one of the area Chinese medicine see from my aspect is very successful. Very successful, okay? Because my training background and was both conventional medicine and alternative medicine. So I know both sides. I try to, that's I told the students, is not to say conventional medicine is better than alternative medicine or alternative medicine is better than conventional medicine. Is what's the best for the individual patients. What's the best for the individual patients? Number one is effective. Number two, and that is safe. Number three is low cost. So you have to meet these three criteria, then say this is the best. Okay. So first, I would like to know, any of you had an acupuncture treatment? Yes. Yes. No, not yet. Okay. So anyway, yeah, no worries. I will, and start with trying to look at both sides and so how this works and what's the expectation. So today's topic is infertility. First is the talk about the fact related to the infertility. Depends different report. Okay, in the United States, infertility affects about 1 in 5 or 6 couple. I would say it's very high. And also noticed with the last 10, 20 years, it's getting increased. The increase, the reason is from the most of the expert is one is because right now and the woman and goes to the school and pursue to the career and lots of women and start to think about will have family after the 30s. This is the big effect. Okay, the secondary and specifically from the statistics looks like is the STD, which is sexual transmitted disease, is an effect. And however, in terms of the infertility, not every woman. That's not fair. Say infertility is woman's mostly a woman problem. No, from the statistics, about 30 is from the male. So the male and could be most of the common is the sperm disorder, which the sperm disorder, one is the low account of the sperm, another is the motility of the sperm. Then also for the woman, and it could be ovulation and dysfunction, so which is related to the hormone imbalance. Then also tuber dysfunction. So the tuber dysfunction, most of the is and related to certain diseases, specifically is STD, sexual transmitting disease, after the infection and the scar tissue, adhesion, and the tuber blockage. It's a big factor. Then also the abnormal cervical mucus, because normal condition, the sperm have to match together, then you get the pregnancy. However, the mucus is just not a fit and for the sperm go to there, so which cannot. And then also very frustrating, undetermined effect. All the lab result is perfect, however, then get pregnant. Okay, so, and with my experience, what's the most successful for the acupuncture and the Chinese herb and help the fertility dysfunctional, hormone dysfunction. That's the most help. Okay, that's the most help. And any questions so far? Okay, so and first let's introduce and what is the traditional Chinese medicine.
Oh, I have a question.
Yes.
How do you address the sperm disorders?
You do have to go to the lab result. Okay. Yeah, you do have that. That's I told my student, 2,000 years ago, no lab result, and 2,000 later, and our eye is not X-ray, our hands not the CT. So you do go to the lab. However, this lab is very cheap, just one time. It's not the big factor. Then like the females checking is more complicated. Yes.
So you go to the lab to check if there's any kind of hormone disorder, and that's from there.
You could, and but also we talk about our acupuncture practice scope. Certain things you can do, certain things you cannot do. In other words, we cannot order the lab. Okay. So what we do, we talk about a little bit later. We could check the basic body temperature, which is indicating the hormone. We talk about it a little bit later. Okay. Any other questions? Okay. So, okay. So Chinese medicine have the literature reported is over 2,000. Actually, it's 5,000 years. Okay, and which and acupuncture and start with and get popular in United States is the start 1972, and the former President Nixon visited China, and then his I think follow, and the people had the appendicitis, and which was in the hospital, and then the visit hospital, saw the acupuncture helped a lot of people. And then came back and was at the New York Post and wrote the paper about introducing the acupuncture, started getting very popular. And otherwise, Chinatown, maybe 100 years ago, state never regulated, they put the needle used, then okay. So right now, no, they are not a professional, they are not a standard, okay? So since then, it's getting popular. Then the acupuncture school in the United States is getting, since 1982 to now, how many acupuncture schools? 70 acupuncture schools. How many acupuncturists in the United States? About 30,000. And also, start the 1982 also national, and start the national exam, which is every acupuncturist most depends where you are, have to get the certification, and then you can get the license. So basically, and from the traditional and the Chinese medicine, and it's the people said, okay, I had the acupuncture, I had the Chinese herb, and it's very helped me and successful. However, WHO, World Health Organization, they listed about 40 different syndrome Okay, I said the syndrome and all disease acupuncture helped. Because the syndrome, for instance, headache, okay, that's the syndrome. And the fertility, you could say it's the syndrome, also could say it's the disease. So, and just lots of things do have the scientific evidence. Specifically, in the 1997, National Institution of the Healthy had the 1 week and the alternative week at the which is and have the release the acupuncture, how acupuncture works from the scientific view. Because in the United States, everything from the government part, everything is evidence medicine. So significant found acupuncture and relieve during the acupuncture treatment induce the body release the endorphin, help the relieve the pain. However, also some studies they showed in terms of the acupuncture stimulation and then also the body biochemistry change and also and the some and the things we are not clear yet but it is working. That's the overall. It's about the acupuncture or the traditional Chinese medicine. Okay, so now. Next things I would like specifically and introduce the acupuncture treatment, because since some of you never had acupuncture, if this is safe, if this hurts, that's the most of the people think about. Okay, so the acupuncture it's in the Washington state is I would say in the United States is about 45 states. It's the government regulator or the state regulated acupuncture. In other words, you need the certification and you need the license, then you can practice. So which basically, and it's the single metal needle, okay? It's pre-steroid, just like any surgical needle, clean. Then this needle also it's called a disposable needle. What's mean disposable needle? You only can use once. You cannot reuse. For instance, I used once in my arm. I feel this not great. I try to put another place. No, you have to put the biohazard container. Use the another one. So the number one, this needle is. And it's safe, will not get any communicable disease. Okay, so then the needle in your body, what's the expectation, what you will feel, and the needle in your body depends different area. Some area the needle get in, even you don't feel it. Some area may be relatively sensitive. How bad? I would say like a mosquito bite. Just 1 second. Then the goal and for the acupuncture treatment and the Chinese medicine is called get the qi. What's the qi? Q-I. Okay, Chinese medicine always said the qi. The qi movement is because in the Chinese medicine, when you have the disease, is the body imbalance. One is imbalance. Okay, another is blockage. So the imbalance in the Chinese medicine, you say the big yin and the yang. You say the okay and the more detailed cold heat. So the body like not too cold, not too warm, and the body like and sufficient good qi. Then if there is bad qi, which is Chinese medicine is called the passageway, will move out. So the acupuncture, the needle, and which we have the purpose manipulate the needle. Would the patients feel tingling, numbness, heavy? Even sometimes like electroshock. So for example, put the needle in your arm. Then next thing is, oh my God, all the way to my finger. So like this, if we just took 1 second, no worry, because actually sometimes if we wanted, we would like a pain to feel. Okay, I'm doing this over 35 years. Never saw any patients and with the nerve damage by the acupuncture. So, however, if things feel too much, we, according to the different patients, and do the different treatment. So some is strong treatment, want to patients feel more. Some is light treatment because the body sensitivity is different. Some people very sensitive, we do the light treatment. So which is not too much stimulation. Then after that, and then you just with the needle take a nap. Okay, so the most patients and feel very relaxed during the needle. You know, you put anything on your needle. Whenever you put a needle, I'm just asleep because the lots of patients just put the needle. Then next thing you hear them snoring. Okay, so good morning, wake up. Your acupuncture treatment is over. Okay, so and that's the basically and is the the acupuncture treatment. The Chinese, any questions? Specific never had the acupuncture treatment people. Okay, all right, okay. Yeah, because the number one people will think about is that safe. That's the number one. Second is hurts. Okay, so I would say number one is safe. And the number two, and you say needle not hurts, that's not real. Very minimal uncomfortable. Okay, so the significant side effect of the acupuncture, I would say bruise, because under the skin have lots of small blood vessels you cannot see. So when and poke the small blood vessel could cause the bleeding, when bleeding and could cause the bruise. So you will get a temporary tattoo, but you will not feel anything. About a week, body take care. Okay, so my experience and with the acupuncture treatment and relieve the pain, that's the number one, because that's the majority of the people and come to the acupuncture, digestion problem, anxiety, headache, and also in the Washington state, that's great. And it's by the law, insurance company have to cover the patient's treatment. Okay. Then talk about the Chinese herb. So the Chinese herb, original, okay, is and the shared food and with herb, basically lots of is the food. We don't realize we take the Chinese herb. Because the way back to ancient time, people struggle to the life. Number one, they would like to have enough food to eat. So, and they make the so-called, and then take a turn. Use taste this time. After you taste that new plant, first, okay, how the taste. Second, people watch that person. If that person okay or had some reaction, and then over. Then found this kind of herb, this kind of food may also can treat the disease. Then they tried, then okay, this will become the medicine. So for example, okay, and I think most of us at the kitchen have the cinnamon. We don't realize cinnamon is the Chinese herb. Also the ginger root. We could find all the grocery store. We don't realize this is Chinese herb. The walnuts is the food. Western medical nutrition, that's great. Tonify, good omega-3 fat and good nutrition. And however, the Chinese medicine said that this is tonifying the kidney, just like this. So for the old age, okay, so the Chinese herb is the technology they don't have developed just different bark, leaves, seeds, and they are and just put it together and then boil and then drink very bitter taste tea. However, right now people say I don't have time to cook every day. okay? Because usually we'll cook the 30 to 40 minutes one time, second, so you need about 2 hours to prepare the herb, too much time. And then the new and the technology, and then had one is the pills, and this is already, it's the standard there, but sometimes not fit for everybody. So, which everybody, even you diagnose with the same disease. However, for instance, we diagnose that person and want to help get the pregnancy, but their herb could be totally different. And some diagnosis with kidney deficiency, some diagnosis with liver chi stagnation, some diagnosis with blood deficiency. So we customize and then the technology and make the herb is like a powder. Then what do? You just get a small spoon and 3 to 5 small spoons and mix with water and 2 or 3 times a day. Okay, so this is very comfortable. So which I would say the Chinese herb and basically I would say if the patients then take any prescription medication, basically I would say most of the part the herb is safe. However, if somebody take the prescription and the medication, then the herb and the drug interaction, that then have enough research. I put that one. Okay, I'm from the MD side said what's going on. So however I feel both acupuncture is have acupuncture part of the work, then the herb have the herb part of work. Okay. Questions first about overall acupuncture Chinese herb the treatment. No. Okay. Now specifically talk about the acupuncture and the Chinese herb and the treat and for the fertility. Okay. So again, this is 21st century, and most of us first start goes to what? First, you just try to get the pregnancy, you don't have to see anything. But from the high school, from the whatever, you already learned a little bit about the how and get the pregnancy and generally how it works. Until you tried about 6 to 1 year, then you start to get worried. What's wrong with me? Okay. I am 32. I never had a significant problem, and why? And I tried the 6 months, I still don't get the pregnancy. Then the people right now, internet is your teacher. So start the internet looking. Okay. Oh, could this, and then okay, look at it and think about what I should do. I should go to the gynecologist, OB, or I should go to alternative medicine. Okay, so I would say it's changed, started changing. When I started practice acupuncture in Seattle way back to, I moved to here 1996, and almost is the acupuncture is the last visit. They start to see the MD first. They start to try this, try that, finally, and nothing work. Then say, I don't care anything, I will try. But now, I think specifically in the Seattle area, is the people are, very, talk about the natural way to heal, don't like the drugs. So right now, we do have lots of patients at the beginning start to see us. However, currently, our student trained is both way. It's not only say, okay, we just need to know the Chinese medicine. We also train the students with the Western medicine. So basically, and from you come, and we would like, because the fertility significant effect, age is, for the female, age is significant effect. Okay, age is significant effect. So basically, we look at first we look at if you are and below the age 35, that age, basically just ask you your medical history. If we don't find the significant early 30s, that's most of the patients who come to us start with the early 30s, and then we ask the medical if we did not find any significant medical history which could cost you infertility, we just start the acupuncture treatment. They say, I'm fine, I tried 6 months to 1 year, I then get pregnant, say, okay, let's start the acupuncture first. How successful? I would say with early 30 patients, just with the acupuncture, I would say about 70 to 80 is with and 2 to 6 months they are got pregnant. Okay, they don't have significant, because what's the problem? They are too nervous. Okay, they are too nervous. And then from the Western medical view, so who control your hormone level? Here, central nervous system, okay, and the country which and the body have the two and the men different hormone, which is the estrogen, progestrogen. That's the significantly okay. They are the lowest level appear to the body, and when the hormone level withdraw, and then that causes the bleeding. Okay, and so with that, we we just suggest the patients get once a week acupuncture treatment. Okay, once a week acupuncture treatment, and for the most of the patient they first they are scared with the needle, but after that I love come to here, make me very relaxing, and take a 30 minutes nap, and then they got the pregnancy. Then for some people, then they are a little bit complicated, which and they said, I don't have any STD, but I doubt I have an endometriosis, because some doctors say that may I have endometriosis, but I'm not sure yet, and because I have real bad cramping, heavy bleeding, and I tried 1 year, I didn't get the pregnancy, so I'm stressed out. So like this kind of patients, and then we would like the patients to do a little bit more things. So for the acupuncture, we could not order any lab, but we have our power. It's what the patients take that every day, the temperature, which and from the science told us, when your body hormone change, your body temperature change. So this is the most easy things to do it. How do it? It's called the basal body temperature, which is start your period first day, and you put the same thermometer. Doesn't matter which one, okay? Doesn't matter. I said, oh, this is around 20 years old. No, you still can use. And before you get up, do anything, wake up, you just stick the thermometer in the mouth. And then you document put the dots there, and then connect it with a line. From very and the basic line, and we will get the general idea, your hormone level, normal or abnormal. This is not to spend any money, okay? Just at the moment, every day do it. So, and then from the basal and the body temperature, then we know, and your hormone level. If your hormone level is real good, looks real good from the temperature, then we would next things suggest you see the MD. If you do, because you diagnosed and with the endometriosis, there is the big blockage. Okay, there is a big blockage. So first we still, if patients don't take any prescription medication, if it is open to herbs, and then we give the herb with acupuncture together. If patients and have the prescription medication, we would like patients to think about it, because there are potential prescription medication with the herbs interaction. Okay, and then we, if tried a couple months still not work, then we suggest patients and CMD, which is do the lab scope, which they could remove all this endometrial cyst. If we remove the endometrial cyst after that procedure, then the patient's very and relatively, I would just put it that way, relatively easy to get a pregnancy in the next 6 months. Okay, so if the patient see the doctor too early, that's also, I look at the age effect. If you are and the late after the late 30s, because and clock is kicking, so we would like integrate to the medicine together. Okay, so the Western medicine, acupuncture together, because if you start the vitro early, successful rate is high. Okay, so however, this is not the necessary effect. And first I said this, then I said the vitro issue. Okay, all the vitro is this is first start the acupuncture. Why? This is cheaper. The acupuncturist in the Seattle area average is from $60 to $100 per visit. Okay, and insurance, most of the insurance not cover acupuncture for the fertility. Only specifically you have some company they said that they covered fertility. In the Washington State, the most of the primary cover acupuncture insurance cover is the pain issue related. You have a headache, you have the painful menses like this, insurance will cover. Then according your policy, is copay is depends none to $30. Most of the probably 15 to 20 something around that. Okay, and then some people said because I do had and one patient and she and her husband come in, and then they said both had the trouble, and the one is had endometriosis, and the one is had this low sperm count, and so both treated, and so once a week treatment, because they said no, I don't think we can access to the vitro, too expensive. I think right now will be about 20,000 per child. Okay, so which and because we just look at the temperature, and it's look at the temperature is not good. So acupuncture once a week, Chinese herb, and she took it apart because she don't want to cook every day. And gradually the temperature is getting better, getting better. So I said, okay, look at your temperature. You should get a price. You do not, and then you may have the tube blockage there. Then I asked, because my form asked, have you had the STD? She did not put anything. Then I said, if you had any infection, low part body, then she said, oh, that way back to 20 years, I was in the college, I had that problem. I just took and 1 week of antibiotic, that's it, I never had any problem. Then I said, potentially you do have the blockage there. So which I suggested, I said maybe you should do tube test. If the person is partial tube is blocked, they had the tube test, they just opened up. Then for that period of time, it's very easy to and get pregnancy. So the bottom line, you have to get the hormone all right. If you don't get the hormone all right, and then tube is open, still not work. And then until, okay, you open up, then wait the hormone regulation, sometimes takes several months. And then the 2 way clock, and closed again. So, and then, okay, she did this 2nd month, she got pregnant. And so she checked that, again, I used the power of the temperature, because she said I checked the 3 times, not the pregnancy. But I said, I look at your temperature, looks like you are 99% you are pregnant. I say, on the home, go home, on the way, you get a pregnancy test. So about 30 minutes later, she called me, Dr. Ding, you're right, I'm pregnant, So anyway, and right now, her son is about 10 years old. Okay, about 10 years old. So that's the one thing with acupuncture, Chinese herb together. Then another bigger group come to us is Vitro, which they are and they went to the Western medical doctor, tried a lot of things, and then nothing worked. Then they tried to the Vitro, which and like this kind of group of person, basically we only do acupuncture, not to do the herb. The reason is most of the MD, they don't want to the herb and have some kinds of the interaction with the strong hormones. From the research, okay, and in Germany, they have the 160 patients and did the research divided 2 groups. So the significance, they just get the Vitro, regular, strong sexual hormone, and the one group not do acupuncture, one group you do acupuncture. What's the difference? Don't do acupuncture group, successful rate is 26. Do the acupuncture with the Vitro hormone, successful rate is almost 64. So from that research, then after that, lots of Western medical doctor institutions, they did the research. Right now, you could see almost all the fertility, institution center, they have the acupuncturist, and which is help them increase the success rate, because the average Vitro success rate is about 30%. Okay. Also, you pay the $20,000, and then all this hormone is not a free range. It's have significant side effect in the lifetime. Even you are very rich, however, you don't want to try too many times. You don't know what's the consequence after 10 years, and with that. So basically, and we advise the patients once a week treatment, and before the Vitro, and then, and according to the different area, maybe close to the harvest transfer, have more treatment, and I say one patient, I give you an example. And she was 42. She tried the Vitro. Did not a success. Then at the age of 52, she tried the Vitro. Okay? And she success. Because the doctor and suggested since your age is 52, because that's the last line. If you're 53, we could not do any Vitro for you, because this is the ethnic issue. So they want to make sure success. Transferred the 2 embryos, she got a twin boy. So absolutely she feel, it's the evidence just, 42, 52, 2 years difference, and one success, one not a success. So I would say, something is there. That's the overall, and in terms of how the acupuncture Chinese herb help and with the fertility. So now I I would like you ask me anything I can help you. Questions?
Okay.
You're okay with that? Yeah, okay. So you guys have any questions?
Do you see any common issues? What would be a common diagnosis with in acupuncture or Chinese medicine, fertility?
The common diagnosis is, person by person different. One thing, and the most that is related to the hormone, is we call the kidney deficiency. However, sometimes also the liver qi stagnation, emotion, stress, making your hormone not work. Example, again, and that will be over 10 years ago, one psychologist. So every day she is working for the people, calm down, counseling, okay? However, that happened to her, and then, because, everybody and seeking for the fertility is stressed out. Because when, how, stuff like that. So, and she was that time, and she was under 42. It's the borderline for the, if do the virtue is well due, and have her own egg or need the donated egg. The fertility jawline, 42, then they, after 3 try, basically they want to use the donated egg. 52, that's it, that's the jawline. So, she was, and went to the one, and the infertility clinic one time, just one lab cost her over 1,000. So she said, I will not go there, because at least I do have one son. That time her son, this elderly son is 5 years old. However, she tried to, went to another acupuncturist, and he very limited. You cannot do this, you cannot do this, you cannot do this. Anyway, and then, somebody referred to me, she come to me, what's the significance? And it's the level of FSH, okay? And the follicle stimulation hormone, and was high, how high? 18. The normal should be around the 10, below the 5 to 10. So basically, and she did the one lab, then the doctor said, you are 42, okay? Your FSH is 18. That means you will not make a good egg, get pregnancy. So we suggest to you and get an egg donor. So she came in, and you can see she's very stressed out. And then we diagnosed with her and with liver qi stagnation. Okay, of course, 42, the age is, it's the age, so also kidney deficiency, that's usually always happen. So, but number one, we treated the liver qi stagnation plus the tonified the kidney. 3 months later, she got a pregnancy. Right now, her son is over 10 years old. Okay, so it's with the different patients that we diagnose different. Like the patients have the endometriosis, then we are diagnosed the qi stagnation, blood stasis, because they are very painful and cramping, stuff like that. And also we did have one person have severe endometriosis, and but that patient worked for a while, about 1.5 years, and finally she got the pregnancy, just the herb acupuncture. Yeah, just really depends the patient's condition. Yeah.
When you say all of these percentages, how much of it is? Are all the men compliant? If they have to, if they also have to be treated, does that contribute to the percentage?
Usually, because the male and the check out are very easy. Okay. So people tried the several months, they are usually the male is the first person check out because I think it only cost $75, something like that. And then, okay, this is no problem, don't worry about it. We do have the one couple, that the female and is the psychiatrist, the male is the PhD, did the research at the university. So, and they both had the issues, and for the female, we just, because we do vitro, just acupuncture. For the male, we do both acupuncture and Chinese herb. So, and they are successful with the vitro. Not ones that had two right now. One is, I think, 80 years old. The one is probably 4 years old. Stuff like that. All right. Yeah. If you would like to talk to me individually, fine. Okay. Yeah, because some. So very privacy. You could talk to me if you want to after this. When I can answer your questions. All right.
Thank you.
You're very, very welcome. Okay.